Magnesium is crucial for over 300 different biochemical functions within the body. These can be anything from blood pressure regulation and nerve function to generating energy. A magnesium deficiency can manifest into diseases like diabetes, poor absorption, chronic diarrhea, celiac disease, and hungry bone syndrome. Today's video is all about warning signs of a magnesium deficiency. Let's get started. Number 16. Calcification of the arteries. Unfortunately, this is one of the first symptoms to appear and one of the most serious. Calcification of the arteries can occur from low magnesium levels. This can lead to an increased risk of heart problems like heart attacks, heart failure, and heart disease. Magnesium's ability to prevent overcalcification is how one study found that eating enough magnesium lowers the risk of coronary heart disease. Half of all heart attack patients receive injections of magnesium chloride to help stop blood clotting and calcification. Number 15. Twitching eyelids. Magnesium deficiency may be the underlying cause of muscular tics. Another early sign of magnesium deficiency is eyelid twitching. Supplementing with magnesium may alleviate this symptom by improving the electric conduct of nerve impulses between nerves and muscles. Number 14. Fatigue. Fatigue and exhaustion are a couple of generalized symptoms when it comes to magnesium deficiency. Sometimes you may attribute your tiredness to stress, poor sleep, or a host of other reasons. According to research on chronic fatigue syndrome, magnesium provides nutritional support to combat fatigue. Magnesium is required for the production of energy. If the body has inadequate access to magnesium, then energy production suffers, leaving you prone to fatigue. Number 13. Muscle spasms and cramps. Magnesium plays a crucial role in helping your muscles relax and regulates muscle contractions. An Epsom salt bath is another form of this important mineral, magnesium sulfate. A deficiency can cause physical effects far beyond cramping, like tremors and even seizures. Studies show the mineral can help relieve cramps and twitches in those who are deficient. Although, for older adults experiencing cramping, getting rid of muscular discomfort isn't as easy as supplementing with magnesium. Magnesium deficiency can cause a secondary deficiency, hypoclampsia, or lack of calcium, which also causes muscle spasms and cramps. Number 12. Sleep issues. Melatonin, chamomile, and lavender can help you sleep peacefully. Magnesium helps to relax your mind and body, both of which contribute to a restful sleep. Furthermore, magnesium is required for proper function of the GABA receptors in your brain. GABA is the neurotransmitter that allows the brain to transition to a restful state, giving you a more peaceful sleep. Number 11. Migraines and headaches. A migraine is the 6th most disabling illness worldwide, causing hours or days of recurring pain, sensitivity to light and sound, and even nausea. A large body of evidence has found that magnesium, whether administered orally or through IV, can be an effective and inexpensive option for the management of migraines. Although the mechanisms aren't fully understood, it is known that maintaining a healthy magnesium level helps preserve the electrical function of brain neurons. Number 10. Vertigo. Magnesium helps regulate the levels of other minerals in your body, such as calcium, potassium, copper, and zinc. Lack of magnesium can increase your risk of developing an electrolyte imbalance, which can lead to dehydration, dizziness, and cognitive decline. If you are often fatigued, dizzy, or lightheaded, stay hydrated by drinking plenty of water. Try adding a magnesium supplement to help reduce some of these symptoms. Number 9. Osteoporosis. Vitamins can lessen your risk of developing osteoporosis, specifically vitamins D and K. Magnesium deficiency puts you at a higher risk of developing this condition, weakening your bones with a higher risk of fractures. Adequate magnesium intake is associated with higher bone mineral density and can also prevent hypocalemia, the condition we mentioned earlier where your blood has very little calcium. Though magnesium can act directly on your bones, it also affects their strength by causing a lack of calcium. Number 8. Irregular heartbeat. Magnesium is a mineral and electrolyte that your body needs to maintain nerve and electrical impulses of the heart. Heart flutters, elevated or slow heart rate, and a racing heartbeat are all signs of a possible magnesium deficiency. In addition, reduced magnesium intake as well as low serum levels have been shown to have an adverse effect on multiple aspects of heart health. According to research, an extra 100 milligrams of magnesium a day was associated with better heart health. Number 7. High blood pressure. Magnesium works with calcium to support healthy blood pressure and heart health. High blood pressure or hypertension can be a sign of magnesium and calcium deficiency. Since hypertension is the cause of 50% of all ischemic strokes, it's best to practice preventative medicine and get enough magnesium. A study found that a diet rich in magnesium may reduce the risk of a stroke by 8%. Another study tested the effectiveness of magnesium supplements on patients with heart disease and found patients who took magnesium twice a day for 6 months had better physical stamina and healthier blood vessels. Number 6. Asthma. Asthma patients tend to exhibit magnesium deficiencies with greater frequency. Researchers generally attribute this finding to lower magnesium levels, causing improperly absorbed calcium to build up in the muscles lining the airway to the lungs. As a result, those passages constrict and hinder breathing. This is why patients diagnosed with severe asthma are often given magnesium sulfate inhalers to instantly expand and relax the airways, plus emergency injections to combat life-threatening symptoms. Number 5. Blood sugar spikes. Although blood sugar levels are heavily influenced by what you eat and how much energy you expend, they are also affected by magnesium levels. This is because magnesium assists your body in glucose and insulin metabolism. A large 6-year study found that low serum magnesium levels were associated with insulin resistance and risk of prediabetes. In addition, it found that common variations in magnesium-regulating genes that cause low serum magnesium were associated with increased risk for diabetes. Unfortunately, the onset of diabetes might compound the problem because it increases urinary magnesium excretion. Number 4. Tingly Extremities. Magnesium makes sure your nerves and muscles are consistently firing as intended. Persistent numbness or tingling in the fingers, toes, or limbs, the feeling like they've fallen asleep, could indicate your body doesn't have enough magnesium to optimally conduct your nervous system's functions. Number 3. Stress. Emotional and physical stress can both cause magnesium deficiency. Surgeries, chronic disease, medications, or traumatic life events can play a part. In times of stress, your body will need more magnesium than usual. If you're already low, stress can exacerbate the problem. The stress hormones adrenaline and cortisol can increase when magnesium levels are low. Number 2. Mental health issues. Mental disorders are another possible consequence of magnesium deficiency. This includes apathy, characterized by mental numbness or lack of emotion. Worsened deficiency may lead to delirium and coma. Observational studies have associated low magnesium levels with an increased risk of depression. Scientists have also speculated that magnesium deficiency might promote anxiety. One review conducted that magnesium supplements might benefit a subset of people with anxiety disorders. A lack of magnesium may cause nerve dysfunction and promote mental health issues. Number 1. Seizures without an existing condition. One of the most severe potential signs of magnesium deficiency. Scientists believe sudden, unexplained seizures may be caused by dangerously low magnesium levels because a significant lack of this mineral can cause abnormal electrical activity in the brain. Experiencing a seizure absent of any other recent symptoms may indicate a need for dietary overhaul, magnesium supplementation, and possibly lifestyle changes. Your body usually gives you warning signs when something is going on behind the scenes. Do you think you're deficient in magnesium? Let us know in the comments below.